Hello, everybody. Sorry about the delay in getting started. I am Dr. Patel, and welcome to this week's Facebook Live to discuss what is the best treatment out there for low back pain. If you are interested in this topic, if you have any questions, concerns, if there's other things that you want to discuss, if you want to talk about something specific about low back pain or other conditions, then please feel free to comment, DM. You can email us at info@fxregencenter.com. And just reach out. Let me know what you're thinking about. Let me know what you're interested in, and we'll talk about that in future sessions. So we've talked about low back pain before. We've talked about the anatomy of the back. We've talked about MRI considerations, X-ray considerations, and we've talked about various different treatment options. So if you're interested in going back and watching some of those videos, they're available on Facebook, and they're also available on our website at fxregencenter.com. So what are we talking about today? Well, we're talking about what do I think is the best treatment for low back pain. What is it out of all the various treatments that are out there? What are the things that can actually cause symptoms to improve on a consistent basis? And quite frankly, what are the things that we should avoid? But, first and foremost, let me go through some of the things that we've discussed in the past, including what are the different types of treatments that are out there. But first and foremost, before even going over the treatments, I will kind of recap some of the anatomy stuff that we've talked about in the past, because I do think it's important for us to make sure we're on the same page with that. I'm just going to draw a few things here, and then we can kind of go over what treatment options there are, and then what I think is the best treatment altogether. So when we talk about the spine, remember I describe it as coffee mugs that are sitting on top of each other. Right here are the mugs. And this is really, it's applicable to any part of the spine, whether you're talking about the low back, the upper back, or the neck. Now these mugs have these discs that sit in between them. And these discs, if you recall, are like water balloons completely filled with jelly. And they're actually they're multiple layers of rubber and then the jelly on the inside, right? Now, each of these discs is a nice shock absorber that prevents us from causing an extreme shock to the spine. They also allow us to have a significant amount of movement. But that's not the only thing that holds those coffee mugs together. We actually have the handles in the back are funky shaped, and the handles of one coffee mug actually touch and connect with the handles of the coffee mugs above and below. And those are where those coffee mug handles touch are called the facet joints. So you can see here that we have facet joints right here, right here, and right here. And we actually have these joints on both sides. So we have the discs in the front and the facet joints in the back. And then we have our various ligament structures, which are the duct tape that connects all these bones together, or as I know that you've heard me say before, those thick rubber bands that surround broccoli in the grocery store are the ligaments. And then finally we have the muscle structures throughout the region, which kind of connect all of these bones together in various ways. And we have core muscles wrapping around the spine altogether. And then finally we have the nerves that travel in this central canal and exit out of these holes to go down the legs in different distributions. And to recap the various different things that can cause pain, well, we have injuries that can occur in the disc that can cause pain. We have disc bulging that can occur that can irritate the nerves. We have the facet joints that can get arthritis or get painful because of sprains to the joints. We have the ligaments that can become issues. We have the muscles that can become issues. Various different things that can cause pain. So how is it even possible to say that there's a best treatment for low back pain, right? Well, there's a lot of different treatments that are out there, ranging from medications to physical therapy to exercise to chiropractic treatments to manual adjustments, osteopathic manipulation, massage, other types of hands-on therapies. There are injection treatments, corticosteroid injections, cortisone injections into the epidural space, cortisone injections into the facet joints, medial branch blocks, radio frequency ablation for the facet joints, trigger point injections, prolotherapy, PRP, bone marrow, adipose. There are so many different treatments that are out there. And some of these treatments are more or less applicable to very specific conditions. But there's one treatment that, in my opinion, really does have a benefit for the majority of low back conditions. And that treatment is movement. So movement might be the most important and the best treatment for back pain. Not only back pain, but also various other pain conditions. Movement ends up being one of the most important things for musculoskeletal conditions. Now you might be saying, hey, but movement is the thing that caused me to get pain in the first place, right? I was bending and twisting and lifting something, and that caused a sudden pain. Or I was sitting for a long time and getting up after sitting, that caused pain. Or whatever it is, I got in an injury, I got in an accident, I had someone do manual therapy or manipulation that caused pain, right? Or I was doing an exercise and it caused pain. If movement is the thing that oftentimes causes pain, why is it that movement is so important for back pain? Well, the reality is that when we have pain, especially when we have pain that's caused by a movement, we end up avoiding that movement, which is normal, which is expected, which is understandable, right? If you're bending and twisting and lifting a 200-pound object off the ground and that causes pain, well, you better believe your nervous system and your brain and your conscious and subconscious will say, hey, I want to avoid that movement, right? That makes sense. But then what happens is, subconsciously, right? Subconsciously, we start then avoiding other movements that may be putting ourselves into a position that's similar, that might be causing some sensations that are similar to when we had our back go out or when we had our pain occur. So we start avoiding those movements as well, right? When we start avoiding every movement or a significant chunk of movements, well, then we start backing ourselves into a corner, and that's when we actually end up adding on layers of issues, right? What happens is this, that fear of movement that occurs, or what we call fear avoidance behavior, right? That fear of movement actually causes our body to start taking on different patterns. Our muscles start to tighten up in different ways in order to compensate for the fact that we're trying to avoid specific actions. And as our muscles start to compensate and start to get into those funky positions, number one, some other things can start to become irritated because we're avoiding normal motion, so we're starting to put ourselves into abnormal motion, number one. And number two, if we even try to go into the motion or into the direction of the motion that we're trying to avoid, then our body freaks out. Our nervous system is like, crap, don't do that. That's going to cause pain. That's going to cause an injury. And our body then reflexively reacts and starts to actually interpret what should be a normal action as a painful or damaging behavior. This is a really important concept to realize, because it's not necessarily the movement that causes the pain. It's doing something in a funky position, doing something abnormally that caused the pain to occur. It's not just movement in general, and that's an important concept that we need to realize. And going to my comments a little bit, what about spine decompression table? Man Mashid Al Abbasi asked, yeah, spine decompression table could be a great treatment. It's a passive treatment, meaning it's something that's done to you. It's not something that you do for yourself. So it could be helpful at taking pressure off of the discs, taking pressure off the nerves, taking pressure off of the joints. However, if we're not doing that ourselves, if we're not moving in a manner that's keeping pressure off of these various joints, well, we can't live our lives on a decompression table, right? So movement and getting moving in the appropriate fashion ends up being key. Debbie asks, what about overuse? Too much movement? Well, that's a great question, right? Because if we are moving too much, can that cause pain? Can that cause issues? And the answer is maybe, right? Well, what do I mean by maybe? Well, this is the discussion that I have with a lot of my athletes, with a lot of my active individuals, especially some of the younger folks that are doing like one specific sport, right? It's not necessarily too much movement, overuse. It's repetitive use. And it's repetitive use of the same thing. So for example, if you're a runner and all you do is run, well then that actually might be a recipe for disaster. Because if you're running 24/7, well, nobody's running 24/7, but you get my drift, right? If you're running all the time and you're just doing a singular motion, well, that's when you get into repetitive use injuries. That's when you get to overuse. That's when you get to too much movement, because you're not also strengthening the different muscles that'll allow you to do that movement that you want to do in the appropriate manner. So for example, for runners, we oftentimes hear of the thing called runner's knee, right? When the kneecap is not gliding properly, well, oftentimes that actually has to do with the strength of our butt muscles, our hip external rotators, or our ankle foot mobility. These are the things that actually cause us to run in the correct manner. But if we don't cross-train and address these other things and we're just running, well then if we do have this maltracking of the kneecap going on, well, that's what's going to cause that overuse injury. Same thing goes for the low back, right? If all we do day in, day out is squats, or all we do is deadlifts day in, day out, but we're not doing the appropriate strengthening of the glutes, if we're not doing the appropriate range of motion of the pelvis, if we're not stretching our hamstrings, if we're not focusing on not just the back but all the other pieces of the puzzle, well then that's going to be a recipe for disaster. So great question, Debbie. And hi, Kathy. Thanks for joining as always. You're always there to support. I'm really happy that all of you guys are coming to support, and I hope these are beneficial for you. Please feel free to tell your friends, tell your family. But no, in all realities, if these videos are beneficial for you, please let me know. If they're not, or if there's something you want me to change about them, let me know that as well. But thanks so much for joining. So back to what I was saying, that fear, I've talked about this before. The fear of movement can actually be a really detrimental thing. And I have to, hand in hand with this is the concept of pain hypersensitivity. And I think this is something important for us to internalize. For those of you who have heard me talk about this before, this is going to be repetitious, but you know what? One of my mentors once said is that repetition is good. Thank you, Mike Furman. But the truth is, this concept of hypersensitivity is so important that I have to talk about my bank analogy again. And again, this is tweaked off of an analogy that I heard on a TED Talk, so I can't take full credit for this, but I did tweak it to be my own. The body is like a bank. When you get an injury, it's like your bank got robbed, right? When you get an injury, it's like your bank got robbed. So what happens when the bank gets robbed? Well, number one, the police come, the fire department comes, the media comes, all of those kind of things. But the bank owner says, hey, the bank got robbed. I gotta up the security system so the bank doesn't get robbed again. But then we get another injury, right? Something else happens. Our bank gets robbed again. So the bank owner is like, shoot, I gotta increase the security system again. But then the bank gets robbed again. And each of these times, the bank owner is increasing the security system, because each time we get an injury or a re-irritation of an old injury, right, it's the body is reacting to that. And the nervous system, which is our alarm system, is getting more and more sensitive. So when that takes place over time, well, then pretty soon a pigeon is walking past the bank and the alarm system's going to go off, right? So the pigeon's not robbing the bank. The pigeon is not causing an injury, or it's not causing damage. Pigeon might be pooping on the sidewalk, and certainly not pleasant, right? It might be causing a little bit of irritation to the area, but it's not necessarily robbing the bank. However, the security system, the nervous system, is so sensitive at this point that it acts as if the bank is getting robbed. So what happens? The gates shut down, the police come, the fire department comes, etc., etc., etc. The body reacts as if it's an injury. This is what happens when we have a movement that causes the pain, and then we start avoiding movement in order to avoid the pain. Each time we're avoiding more and more movement, because movement causes us to think that our bank is getting robbed, right? That's really important. Internalize that, right? Because if we start thinking that, all right, bending forward or squatting or, lifting something, if our body starts thinking that that's automatically going to be causing damage, then our body's going to be doing less and less and less, while our sensitivity to movement is going to become more and more and more. So it's a really important concept to consider, that the fear of movement and pain hypersensitivity can often come hand in hand. So instead of avoiding the movement, right, instead of letting the alarm system go off when the pigeon's walking by, we have to retrain our bodies, retrain our nervous system, and really retrain our subconscious mind into recognizing that not all movement equals pain, and not all pain equals damage. Right? Because if I'm not moving for a very, very long period of time, and then I start doing some movement again, I start doing exercise again, you better believe I'm going to feel some pain. I'm going to feel some soreness, some muscle tightness, etc., etc. But that's okay. That's your muscles waking up. That's you getting back to doing an activity. That does not necessarily equal damage. And we need to retrain our bodies, our nervous system, our minds to recognize that. Kathy asks, so if bending forward and hanging as down releases pressure in the low back, is that muscles or pushing on nerves? So if bending forward releases pressure in the low back, is that muscle or pushing on the nerves? It's hard to say, right? If bending forward causes pain, or if bending forward reduces pain, it could be various different things that are involved with that, right? Sometimes bending forward puts more pressure into the discs, right? If you bend forward like so, then that's going to put pressure into the discs, and that could either cause the discs to be painful, or if you put pressure into a water balloon, it could cause the disc to bulge outwards and irritate the nerves. But if you're bending backwards, that could put pressure onto the facet joints. And if we're bending backwards and we have stenosis, or narrowing of where the nerve is traveling, that can cause the nerves to get irritated there. So directionality of your pain can play a factor in helping us diagnose what is or is not a part of the picture in terms of the symptoms. But we shouldn't let that directionality completely dictate what we can and cannot do. So for example, if you have an issue with your disc and bending forward causes pain, well, avoiding certain things that cause a substantial amount of pain or cause the disc to significantly get irritated could be a good idea, but still bending forward might still be okay within certain parameters. Or if we're paying attention to our core strength, if we're activating the appropriate muscles, then we may be able to bend forward and be perfectly fine. So I had a patient today who has recently developed some pain in his ankle and, not his ankle, in his hip and his buttock region. And he had a similar situation on his right side, last year that resolved kind of on its own. And he has had a history of significant back pain with stuff going down his legs in the past. We treated him with a variety of orthobiologics, PRP type injections, and really focused on exercise. And his back has actually been 99% improved since a couple of years ago when we treated him. But he's still not moving the greatest. He hasn't been moving the greatest. He's doing some exercises, he's doing some stretching, but he hasn't actually committed to doing a significant amount of exercise. So now he's got various different things that pop up every once in a while, like his hip and his his buttock area. So we did a new MRI, and we see big old disc bulges on the left side that are contributing to the symptoms that are going into his buttock and down his leg. Well, what's interesting about it is he's got big old stuff going on the right side. He's got arthritis, he's got disc degeneration, and he doesn't have any back pain at this point, and he doesn't have any symptoms on the right side. And he's able to maintain a great range of motion despite this increase in pain recently. Now, if this same patient, we told him, hey, you need to be on bed rest for 2 months, you need to not do any activities, well, then the situation would significantly deteriorate. He would not only start feeling more pain when he was doing any motion, but then his muscles would atrophy. He would start getting weaker. He would start putting more pressure onto the discs, and invariably, the things that are issues on imaging on the right side would start rearing their ugly heads in symptoms. But instead, we're going the opposite direction. We want to keep him moving. We want to keep him active. So we might do some treatment to his low back in terms of orthobiologics to improve some of the nerve firing and improve some of the disc bulges, but the focus is really going to be on making sure we do the appropriate exercise to keep him moving correctly, to strengthen the core, to take pressure off of these things that could potentially become issues, because we don't want to kind of sit back and do nothing and let things get worse. Debbie said nerve pain takes longer to go away. Well, yeah, nerve pain, especially when there's nerve damage, nerves take a long time to heal. Take a really long time to heal. Now, we can try to speed up that healing, and there's certain treatments that we can do. Injections of things like your own blood growth factors, PRP, could potentially improve nerve healing and speed up that process. However, it's fairly common for nerves to take a very long time to heal. But here's the thing, nerves, muscles, tendons, ligaments, all of these structures, if we put them through the motions that they normally go through, there's a better opportunity for them to heal in a functional way. Let me repeat that. If we continue to do things with our body the way that we're supposed to be doing them, then it gives a better opportunity for injuries to heal the way they should. So I'm going to move away from the back for a second and talk about the ankle. Remember when you're a kid and you twist your ankle and that ankle swelled up, right? When you sprained your ankle or twisted your ankle, the old mentality was, let's put that ankle in a boot or in a strap, let's immobilize that ankle. Let's rest, let's elevate the legs, right? Let's use ice, Let's use non-steroidal anti-inflammatory drugs so we can decrease the swelling, decrease the inflammation, and allow healing to take place. Right? That was the old mentality. What we're doing now, or what most people should be doing now, is none of that almost. Right? In actuality, when we sprain our ankle, that swelling that takes place, that initial inflammation is the first part of healing that takes place. And if we completely stunt that with non-steroidal anti-inflammatory drugs and ice right away and completely resting, well, that's going to slow down the healing process. But more importantly, if we completely immobilize that joint and allow it to heal, well, that's when the ligament heals in an improper manner. That's when it heals in a static position and not a dynamic position the way that it's meant to be. Right? If we completely immobilize the joint, that does not allow it to heal appropriately. So there's an interesting company that I may start working with that's created a brace for the ankle, for example, that allows for some dynamic stability. It prevents too much motion, but still provides some security to help with healing of conditions like this. Because the reality is we need to move the body in the correct fashion for the body to know, all right, this is how we should be healing it. Right? The ligament should be a mobile structure, and that's how it should heal appropriately. But if we don't move, our body's not going to know how to heal the way that it should. So the same thing goes for nerves, joints, ligaments, muscles, all of those things. We have to keep on moving. And Kathy said, well, yeah, I guess my ankle is messed up because that's the way that you healed when you sprained it. And that's why people repetitively sprain their ankles. Once you've sprained it once, you're going to sprain it again because we're not allowing it to heal the appropriate way. Now, there's still good things that we can do to help it heal. Even if we've had abnormal healing in the past, there's still definitely things that we can do to help it. But this is something that we need to acknowledge, that we're learning more about the way our body heals, and we have to allow it to heal in the way that we want it to. So, final little thing about movement, there's actually been a lot of study about movement. In fact, for low back pain, the most consistent treatment that has been studied and shown to be beneficial for low back pain as well as other conditions, even things like fibromyalgia and knee pain and various different things, but especially for the low back, is exercise. And different types of exercise have shown benefit. Special programs that are focusing on extension or flexion-based exercise, McKenzie protocols, Pilates, Tai Chi, yoga, even walking. There's a lot of different treatments that have been shown to be beneficial for low back pain, but the similarity, the commonality behind these is all movement. Really what it comes down to is that we don't want to shy away from movement. We don't want to develop a fear of movement. We want to actually move. Now, sometimes we have to do movement safely, appropriately, right? I'm not saying that, hey, you should go into sprinting or running a marathon if you have an acute back injury. I'm not saying that, hey, if you bent over and you blew out your back, you should just go straight back into bending over haphazardly. I think the appropriate movement, guided exercise by a physical therapist or some physicians, chiropractors, etc., some guided mobility can actually be really, really helpful. Doing the right things, having somebody watching you, working with you, making sure you're doing the right things, really, really important, but ultimately is movement. There was a really important fundamental rehabilitation study from a couple decades ago by a guy named Dr. Deyo, D-E-Y-O, fundamental study that showed with low back pain, we really should be resting only 1 or 2 days. If you have an acute pain exacerbation where things are really, really bad, we really only should be in bed rest for 1 day, maybe 2. Because after that point, we have a point of diminishing returns. That's the point where we start resting more and more and more because movement causes pain. But that ends up being counterproductive, and that lack of movement actually causes the pain to be worse. So if you do have an acute back pain episode, it's fine to rest for a day or 2. But then you got to get back to moving in one way, shape, or form. That is the best treatment for low back pain. So I hope this was helpful for you. I really appreciate you tuning in. Thanks so much, everybody, for the comments. Kathy, one last one. I started walking again. At first, my low back was very sore at half a mile, but now I'm up to 3 miles and it's getting better. That's what I'm talking about, Kathy. That's what I'm talking about. It's going to be painful initially. It's going to be painful. But as you move more, you're going to feel better. And there's a lot of things that we can do to augment that, improve your symptoms. There are medications, nutrition, supplements, injection treatments. There's a lot of different things that could be a part of the picture. But the commonality, the most important, the fundamental thing for your low back pain is and always will be movement. Hope you enjoyed this. Please share. If you liked it, like it, share it. And of course, hit me up if you have other topics that you want to discuss. We're going to be doing back pain for the next few weeks then. And actually next week, I'm not going to have my Facebook Live, so tune in a week after that, and we'll get back to it. Wish you guys the best. Have a happy Friday and a happy weekend. I'll see you guys in a couple weeks.